Welcome to the Lifeguard Approach, a video that explores why sobriety is not the only path to healing from substance use disorder. We must move beyond the abstinence trap, where the only choices seem to be active addiction or total abstinence. Forcing this binary choice keeps millions from seeking help. Instead, we must explore the revolutionary compassion of harm reduction, where small gains matter more than massive leaps. Addiction is often a solution to deep emotional pain or trauma, creating a desperate need for relief. This can lead to a dopamine deficit state, which is further exacerbated by stigma and criminalization. People aren't trying to drown. They are trying to escape a fire on the shore. The Lifeguard philosophy embodies three core principles: autonomy, meeting people where they are; pragmatism, accepting that drug use is a reality; and compassion, protecting the individual regardless of how they got into the water. Lifeguards prevent drownings without judging people for choosing to swim. Harm reduction redefines the standard of care. The primary goal is improved quality of life. Relapse is viewed as a symptom, and motivation comes from internal discovery and empowerment, rather than shame or legal mandates. Stigma, reinforced by language, healthcare, and policy, is the number one barrier to treatment. Shame is deadlier than the undertow. Changing our language from moral failure to medical patient is a life-saving tertiary prevention intervention. Practical tools for survival include naloxone, which reverses opioid overdoses, fentanyl test strips, which identify lethal adulterants, and syringe service programs, which prevent bloodborne disease transmission without increasing drug use. Overdose prevention centers are safe harbors. Vancouver's Insight facility, for example, has seen 0 deaths in millions of supervised injections, a 35% decrease in fatal overdoses in surrounding neighborhoods, and a public safety win by cutting discarded syringes in half. Calming the neurological waters involves both biological stabilization and psychological healing. Medication-assisted treatment acts as a biological life raft, restoring homeostasis and silencing cravings so the brain can begin to heal. MAT is the gold standard of care. Harm reduction is empowering, not enabling. The fact is, participants in syringe service programs are 5 times more likely to enter addiction treatment than non-participants. You cannot enter recovery if you do not survive the addiction. Harm reduction protects everyone. For the individual, it prevents fatal overdoses. For the community, it reduces public disorder. Economically, every dollar invested in syringe access yields up to a $5.50 return by preventing lifetime HIV treatment costs. Success is not a binary. Harm reduction empowers individuals to design realistic metrics for success, removing the shame of imperfect sobriety. A Seattle study showed a significant decrease in alcohol use and related problems without mandating sobriety. True recovery is an ecosystem of healing, moving a person from disintegration to integration. This includes biological stabilization, psychological healing of underlying trauma, and social connection with a community that sees the individual as more than their disease. Equip yourself and save a life. Carry Narcan. Change the narrative around substance use. And most importantly, love without conditions. Watch how quickly people transform when they are loved exactly as they are.